Good afternoon, everyone, and thank you all for joining us. I have with me, of course, our Public Health Director, Dr. Ngozi Ezike, and this is our 2:30 update. It's been a week since we had our last update on our state's efforts to acquire personal protective equipment. So I wanted to provide a quick update on PPE since March 30th. I want to start by highlighting shipments to Illinois from the federal government. This is most often referred to at the federal level as the Strategic National Stockpile. 2 weeks ago, I explained to you that the stated purpose of this supply is to support states and local government supplies during a public health emergency severe enough to cause local supplies to run out. In fact, I was quoting back then, and just quoted to you, the language that appeared on the website of the Strategic National Stockpile. Then, at the beginning of this month, the website was changed. Suddenly, the website no longer said that the SNS would support states, but instead now said that the SNS is meant only to supplement state supplies during public health emergencies, and only as a short-term stopgap buffer when the immediate supply of adequate amounts of these materials may not be immediately available. In total, the shipments that we've received from the Strategic National Stockpile, a mere fraction of what we've asked for, were 367,700 N95 masks, 1,141,000 surgical masks, nearly 693,000 gloves, 174,000 face shields, 142,000 surgical gowns, and 4,000 coveralls. Again, this is a small fraction of what we need and what we have asked for. If we had relied upon the White House and its obligation to fulfill our needs from the SNS, our state and nearly every state in the United States would come up short and could not protect our healthcare workers and our first responders. But here's the good news. We haven't trusted what we were told by the White House. Instead, members of my governor's office, IDPH, and IEMA have been working tirelessly to pursue all other routes to acquire additional PPE for the fight against COVID-19 in Illinois. We continue to source and ship as much PPE as we can from all over the world, bringing it to Illinois by whatever means necessary. As illustrated on one of the boards that's next to me, to date, we've ordered nearly 10 million N95 masks, over 14 million KN95 masks, 7 million surgical masks, 22 million disposable general use masks, over 19 million gloves, over 5 million face shields, over 3 million gowns, and more. Take note that this is not as simple as placing an order and having it arrive at your doorstep a few days later. There's a worldwide shortage that has us racing the clock and battling against other states and the federal government. This is an ongoing, around-the-clock process of scouring the globe to identify what PPE is available, reaching out to the producer with a better price and a faster payment than our competitors, overcoming the machinations of shipping across the world during a worldwide pandemic, and attempting to leave nothing to chance in all of that process. We're involved in every granular detail of every step until the PPE arrives in our warehouse. We've been doing this day in and day out, again and again over the last 4 weeks or so. Here's why. We need to outfit our heroic healthcare professionals to allow us to outfit them for the existing beds, but also for the additional hospital beds that we're adding all across the state. And I'll be providing a fuller update on that tomorrow. But as of Friday, we had increased hospital beds in Illinois to about 28,000 non-ICU beds and 2,680 ICU beds statewide. Each of those beds and all that we've added since, and the patients, COVID and non-COVID alike, that need them to heal, require a full team of healthcare professionals properly outfitted in PPE in order to do their jobs correctly every day, every hour, every minute at the hospital, saving lives while they're protecting their own. Right now, we're looking at a statewide 10-day PPE burn rate of just under 1.5 million N95 masks, 25 million gloves, 4.4 million gowns, and 700,000 surgical masks. And that's just across our hospitals and long-term care facilities, with small set-asides for our law enforcement to make sure that they are fully covered, and our essential state workers. That's also before you count the McCormick Place alternate care facility, which we project could bring our surgical mask burn rate to over 2 million across that 10-day period, to just offer one more example. As you can see, when you compare our federal shipments to our burn rate, the product that we've received from the federal stockpile will last only a handful of days in this multi-month battle. It's our own state procurement initiative that is making the difference. To anyone who wants a response to some of the blame shifting coming out of the White House, all I have to say is, look at the numbers. Here in Illinois, I'm doing everything within my power as governor to keep the PPE supply stream flowing. I have enormous respect and gratitude, truly, for the civil servants inside of IEMA and IDPH who are managing inventory in our state PPE warehouses and sending it out to hospitals and local health departments so that every part of the state gets what they need. I'm also grateful to the people within my governor's office who've launched a whirlwind, all-encompassing operation to analyze the global PPE market and chase down every last product that they can find. And a big thank you to the incredible, truly incredible, experienced public servants inside of FEMA, the U.S. Department of Health and Human Services, the Army Corps, and the entire U.S. military. The people who know that their duty is to the residents of this country. These are all people who are fighting like hell for Illinois, even with one hand tied behind their backs by the White House. To all who are listening, I just want to say, I know that this fight has taken on a new meaning as COVID-19's presence in our communities has evolved. Less than a month ago, it was hard for everyone to see how important early action would be to get us ready for what has seemed like an invisible enemy whose terrible impact had not yet been truly demonstrated. We have now lost hundreds of Illinoisans in the fight against COVID-19. Thousands of family members, loved ones, friends, and neighbors are grieving. The loss of each and every single individual offers a unique, unbearable pain for all of the lives that they touched. And cumulatively, they reflect the disproportionate burden that this virus places on some communities more than others. We're facing a crisis, and we have to face it honestly. Communities of color, and particularly black communities in the city of Chicago, suburban Cook County, and cities and towns all across our state, disproportionately shoulder the health care conditions that lead to worse outcomes with COVID-19. And to put into words what often is left unsaid, that's a product of generations of systemic disinvestment in communities of color, compounded by disparities in healthcare delivery systems and access. Acknowledging that truth is just one step. Our actions have to reflect our reality. The number one way to do that is testing. As I've said since the beginning, the lack of testing at a national level over the last few months has been a massive hindrance to our ability to respond to and contain COVID-19. I've called out the federal government and called upon them to step up in the ways that only they can. But in the meantime, my team has worked to expand testing where we have the ability to do so and ensure that we're not testing any one community more than any other community. That means adding more drive-through testing facilities, working with rapid test companies, and building up our own in-state lab capacities. As I've said, we're not where we need to be, but we are determined to get to a place where we're testing widely in our nursing homes, in our correctional facilities, and in our communities, where anyone who might need one can get a test. That's our goal. We also have worked to massively expand hospital capacity directly in communities where we predict we need to exceed our existing capacity. We've added thousands of beds at our existing institutions and are standing up supportive facilities at McCormick Place, at Westlake Hospital in Melrose Park, Metro South Hospital in Blue Island, and in other locations across Illinois. My team and I are continuing to operate with our eyes trained on these disparities because that is the only way to address them. We are working to hold ourselves accountable in everything that we do. That said, I say again to you, our strongest weapon against COVID-19 is you, all of the people of the state of Illinois. We have to be all in for Illinois. So please stay home and work from home if you can. If you have to leave home because you are an essential worker, and if you're sick or a member of your family is sick, this is not a time to tough it out. Isolate if you can. See a doctor, call a doctor first if your symptoms are severe. Hold your family members accountable. Just about every insurance company is waiving copays related to COVID-19, making it easier for any person who has symptoms to get the treatment that they need. Please protect yourself and your community. We can't quantify your actions like we can PPE and available tests, but I promise you we can't get through this without all of us doing our part.